This is Healthcare Uprising. We are here to shine a light on the innovators implementing positive change in American healthcare and the patient experience stories, good and bad, that can help others navigate the sometimes overwhelmingly complex American healthcare system. Welcome to the Uprising. We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So what's on our agenda for today, Heather?
So today we're speaking with Casey Dubravcic, founder and owner of Revitalize Ketamine Clinic, with locations in Flagstaff, Sedona, and Prescott Valley, Arizona. He's also the visionary behind ROHCT Wellness, which operates in Flagstaff and Prescott Valley. Casey is a board-certified psychiatric mental health nurse practitioner committed to redefining mental health care. With a background that spans critical care, cardiovascular intensive care, and both inpatient and outpatient psychiatric care for adults and adolescents, Casey's experience is vast and impactful. He served as the only child psychiatric provider at the Guidance Center in Flagstaff for several years. This unique role ignited Casey's passion for psychiatry, particularly in helping people feel understood and uncover the roots of their coping strategies. Through his journey, Casey recognized a pressing need for transformation in mental health care, one that prioritizes wellness over traditional approaches. In founding the Revitalize Clinic family, Casey and his dedicated team are reshaping care delivery to promote a wellness-focused model and make this transformative approach widely accessible. And we also call him Dr. Casey for short.
Well, sounds like we're going to get a little deeper into it on this one. Looking forward to it. That's quite the background. Sounds like it's going to be an interesting conversation. So without further ado, here is our interview with Dr. Casey.
All right. Hi, Casey. Nice to meet you. And thanks for coming on Healthcare Uprising.
Yeah, absolutely. Happy to be here.
Awesome. So, fun fact, we're actually all here in Flagstaff, Arizona. Not sitting in the same room, clearly, but
Yeah, what is this pandemic all over again? No, thank you.
we're
At
just
least you guys aren't
trying
wearing
to.
masks, so it's good.
No masks today. But Casey is actually located here in Flagstaff. So, Casey, can you tell us a little bit about yourself, your background, who you are, what you do, and ultimately what brought you to establish and create the Revitalize Clinic here in Flagstaff?
Yeah, absolutely. Happy to. So originally from San Diego, I moved to Sedona actually in fourth grade. So I moved to Flagstaff in second grade, moved back to California, kind of up and down California coast. Grew up in Ocean Beach, California, and then moved to Santa Cruz and South City, and then to Flagstaff in second grade, back to Valley Center, California, and then moved here to Sedona in fourth grade. Sedona fourth to ninth grade, and then Flagstaff ninth grade and on. And was the class president of Northline Preparatory Academy in 11th grade, and then they went to uniforms, and I was like, uniforms, I like punk rock. And then I moved on to Flag High. I graduated Flag High 2000, and then it kind of bounced around. I was pre-med for a little bit. I was math major for a little while. And then we started dating in 2003. My wife now and mother of my children, was into nursing, and I was like, oh, this seems cool. And so I started going into checking out nursing, and I really liked the three P's of nursing is what I call it, like personability, profitability, and portability. So you could do the 6 on and then 8 off, and you could travel with nursing. And then I worked in the intensive care unit, the cardiovascular intensive care unit, the pre-op PACU, and then I worked inpatient, outpatient behavioral health units at Flagstaff Medical Center. Trained under like Jay Collier and Blaine Henderson, Adam Collier, or Adam Graff and Jay Collier, and trained electroconvulsive therapy over there. Inpatient, outpatient, adolescent, and adult unit. And then I worked at the inpatient, outpatient community mental health center here at the Guidance Center. and I was an only child provider for a couple years. And to be honest with you guys, I got pretty jaded in the traditional psychiatric care. If you think of mood super basically, right, as a waveform, kind of that depression, the anhedonia, kind of I don't cares down here, and then anxiety, hypervigilance, that kind of like pucker, that fight, flight, or freeze up here. People with trauma, they're bouncing back and forth a lot quicker between those two. And pretty much every medication I would prescribe in traditional psychiatry, SSRIs, SNRIs, mood stabilizers, antipsychotics, benzodiazepines, hypnotics, like 10 to 30% effective long term, and just kind of squishing that waveform. So people may be less depressed, maybe less anxious, maybe less mood lability, maybe less suicidality, in general, kind of less everything. In my opinion, and a growing number of psychiatric providers, is those symptoms are really your psyche's cries for help. And so, really, at this point in my career, I know it's like a lot to intro, is I don't like any diagnosis besides trauma, and I think every and ADHD, but trauma, everything in the DSM is really like a coping strategy for trauma, in my opinion. So, like depression, you're kind of withdrawn. Every catecholamine or stressor exposure, looks like it could potentially be bad for you. Anxiety, hypervigilance, everything looks like a hot plate because at some point in your life, everything was a hot plate. And so you're going to be quicker to react. Substance use disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder. We call those bipolar light. And then it kind of goes down, depends on the extremeness of the situation. Like I worked in the community mental health center, right? And so I saw like these street paranoid schizophrenics, street alcoholics, and you look at their childhood, you look at their where they grew up and where they came from. And then you look at what we call the ACEs score, their adverse childhood experiences score. Basically, their reality was so unsafe for so long, they needed to create an alternate reality for themselves. And in that alternate reality, it was safer. Like you see women in paranoid schizophrenia who are screaming and yelling at themselves, like out in public, they're going to be less likely to be sexually traumatized by like other, people on the street. And it's interesting when you start noticing that. And I'm not saying that there isn't like a component of a biological predisposition. Obviously, like that's a thing. Like people are more likely to be depressed when they come from depressed people. That being said, we're all a kind of product of our environments. And so I think everything falls from trauma. I think trauma is super subjective. There's four main types of trauma. It's a long diatribe. I could go into it, but it's a long intro already. So here I am.
No, that's interesting. So when did you establish the Revitalize Clinic? And then also to I know that you have the ROHCT wellness clinic as well. If you could talk a little bit about your clinic when it kind of came to be. Obviously, I think ketamine clinics too are kind of a newer concept still. I think a lot of people don't even realize they exist. So
Yeah, yeah, for sure. I think so ketamine clinics have been around since the late 1990s. The first study that I know of was actually in 1989 in Russia, where they were looking at ketamine infusions for trauma, and they were finding like curative for alcoholism, curative for PTSD, and very interesting. So it's been around since the 1960s. There was Calvin, something he derived PCP first, and then ketamine is really closely related chemically to PCP. And PCP is not a great anesthetic. Ketamine is a great anesthetic. And so it's on the World Health Organization's list of essential medications as an anesthetic because it's the only anesthetic that doesn't decrease respiratory drive by itself. And it actually increases your cardiovascular drive, which is good. It raises your blood pressure. So when we're giving ketamine in our clinic, very low dosing compared to what they would give. They say ketamine will be on the first trip to Mars because you can give it all by itself and like do a C-section, do a leg amputation. You don't need to give a concurrent pain medication. You don't need to give a sedative. You don't need to give an anxiolytic. The reason they don't give it in the OR like all the time anymore is because of repressed trauma surfacing. And so what a lot of people see as a bad trip is often things that need to surface, that need to be processed through. So that's why it's really important to emphasize the setting and sustainability. So like I'm a big fan of, the dose makes the medicine and the dose makes the poison. There's nothing inherently evil or nothing inherently good for that matter. So it's like you can overdo anything, right? Like you can be super duper skinny and be very unhealthy, and you can be
Right.
super obese and be very unhealthy. And so it's like, there's you need to find a balance. Like you should, and as human beings, we need to live like halfway parasympathetic nervous system and halfway autonomic nervous system activation. So you need to be able to fight if you need to, and you need to be able to like rest and digest if you need to. And then what happens like in ketamine or in other ego dissolution agents is you get out of your own way so much that you're just living oftentimes in this so I think of ego dissolution as the walls that we build for ourselves, right? For some people, that ego looks like depression. For some people, it looks like anxiety. Some people it looks like substance use disorder. And like to a lesser extent, it looks like going to the bathroom and eating and talking to people. But the higher the extreme of what you're being subjected to, the higher the walls we build. And so all the ego dissolution agents act very similar, and they're letting the walls down safely. And so when you're giving ketamine pre-hospital, you're giving 2 to 5 milligrams per kilogram all at once intramuscularly primarily. In our clinic, we start everyone at zero point 0.5 milligrams per kilogram over 45 minutes. And I really like the IV ketamine. I think it's far and away the safest way to do it. And so ego dissolution agents as a family, there's nuances and differences between them. Best well-tolerated ego dissolution agent, large swath of the population's MDMA or ecstasy. And so that looked like that was going to be coming available by the end of this year under insurance coverage. So in our clinics, we pursued insurance coverage, which we have now, in large part because we were hopeful to be able to be one of the first purveyors of that. That being said, there was some study design stuff, and so that's not going to happen for a while. Second
And
best
you
well-tolerated,
said
but
ecstasy? Is that
yeah,
did I
yeah,
I'm like
MDMA,
I'm
yeah,
like
that's
tap
right.
tap is this thing on?
Yeah, yeah. So the Multidisciplinary Association for Psychedelic Studies, Rick Doblin, MAPS work,
Maps.
they
I
do
am
their
very
yeah,
familiar with them
yeah, yeah.
actually.
So
Yeah.
that's been their emphasis. They recently had a
Oh,
spin-off, Lycos
this is so
Therapeutics,
cool.
but Rick Doblin, he's been working on this since like the 70s.
Okay.
And Kate Hawk, who I'm intimately aware of in town in Flagstaff here, she recently moved to Santa Fe, but she was one of the kind of founders of MAPS with Rick
Oh,
Doblin. And
gotcha.
so we've worked together on a number of projects. She's super amazing. I love their ethos. And so, yeah, ecstasy is more of an empathogenic versus a psychedelic.
Mhm.
And so ego dissolution agents, empathogenics, psychedelics, there's lots of ways to kind of say the same thing, but basically you're getting out of your own way. And
Mhm.
so MDMA best well tolerated, ketamine, the second best well tolerated as a dissociative anesthetic. So I like to say you zoom out far enough, you can find the gift, right?
Mm.
And then kind of a cone of intensity, just because we're already going there, not as well tolerated by a heavy swath of the population because of the extent of perceptual distortion. So things get really out of hand, and so a lot of people don't know how to handle that. And so obviously dose dependent, but psilocybin magic mushrooms at the bottom, then LSD acid, then mescaline peyote, then ayahuasca DMT, and then 5-MeO DMT or the Sonoran toad kind of at top.
Mm.
Iboga is kind of on its own. It's a different thing. Combo is kind of like 5-MeO. And there's a couple other random ones in there. But basically those ones and MDMA, to some extent, in my opinion, you're opening up something else that is really hard to do in a clinical situation. Like evolutionarily, all this stuff happened too quickly, right? Like our brains haven't caught up. We should be going to sleep with the sun. We should be waking up with the sun. We should be living off the land with like 13 families where everyone's a cog in the wheel, and that your role is super well appreciated and needed for the tribe to thrive. That gets lost in an economy of scale. Everyone kind of feels replaceable, from really amazing podcast, producers to other awesome human beings and even psych providers, right? Like we're kind of, it's dime a dozen in some extent. And when you're in a tribe, people need you. And so with that, I think it's important to recognize, especially with these longer acting ego dissolution agents, that we all bring our own trauma into every interaction, right? And so, like, that being said, like, some days I'm going to go to work and I'm going to be 40% of the provider that I could potentially be. Because I'm dealing with stuff at home, or the kids are sick, or I'm grumpy, I didn't eat enough, whatever it is. And then that's going to come out when you have an 8 to 12 hour therapy session, like, regardless of how good you are at your work. And so there's a lot of what we call transference and countertransference. So, whereas like that client reminds me of someone from my past that I didn't like, right? Or I like too much. Or I remind them of the same type of situation, and thereby you act accordingly. And so with ketamine, particularly the intravenous form, the three reasons I like it the best over all that other stuff: best bioavailability, the best efficacy profile, is they've been around since like late 1990s ketamine clinics with amazing results, like up to 95% effective for suicidality. It's bonkers. And then the third reason is the only version you could pause, right? And so like 2 to 5 minutes, you're super steady state. And then it comes off, and it comes off real gently. So really, like, so much of my treatments are about like empowerment, like you're driving your bus, right? Like it's much better if you're driving your bus and you remember that you're capable of driving your bus. And the patriarchal model of medicine sucks. Like, you take this pill and you'll get better and call me in the morning. It's like,
Hmm.
no, it's like, let's figure this out together. Like, I'll be a resource for you, but really my job is to help you remember how capable you are. And it's been so interesting. Like, beyond the mental health benefits, we see a lot of physical benefits, like chronic inflammatory disorders kind of get better downstream. Quick story is, like, I think of the gazelle that gets caught by the lion, right? It goes into this fight, flight, or freeze state, like, oh no, I'm screwed, like I'm gonna get eaten. And then the lion is like, okay, cool, like I got my prey, I'm gonna stalk around, be a lion. Gazelle realizes it's got an opening, it pops up and it runs and it runs. And then 3 to 5 miles down the road, it's got this physiological shudder, this whole body release, like cellular level. And that's still built into our DNA as human beings. And so the first thing we need to do is, like, people need to feel safe to feel safe. And a lot of people come to me and they've never had that. They never experienced that in their bodies. The stress starts at conception, right? The amount of catecholamines that mother is exposing that child to in utero. And then it just goes from there, for a lot of people. And it's all healable. Every bit of those traumas, those big capital bold T traumas, like those early and often physical, sexual, emotional abuse or neglect, and those little italic T's, right? Like, you're watching a funny movie with a loved one, sad part comes out about a puppy, and you're like, oh, and that's sad. And they're like, oh, you're stupid, Casey. It's not sad. It's like, oh, that hurts. So, long answer to the question. Opened in 2021. Very passionate about helping people help themselves again, that remembrance, that empowerment. We've got 3 clinics. We've got Flagstaff, Sedona, and Prescott Valley. We got really great clinicians in all 3 locations. My wife and I, she's at least twice as smart as me. She's a psychiatric mental health nurse practitioner, same credentials as me, but she's also dual certified as a family nurse practitioner. And so between her and I, we oversee our clinics. We like to use anything we're using as kind of a catalyst for change. And we're of the school of thought that less is more. And so, that being said, like, if we can win the first race, like, I can help you win that first race. Like, you can lose that 5, 10 pounds, it's because we do the GLP-1s, we do wraparound care, we do lots of other things. In addition to, I think we're really, really good at how we do the ketamine. And so that's where I emphasize it's in our name, right?
Hmm.
And then we just real recently opened up ROHCT Wellness Bar. And so we talked about it briefly, but the ketamine treatments and the transcranial magnetic stimulation that we offer, as well as the Spravato esketamine, are kind of, for most people, viewed as a more extreme interventions, right? And like, you've been struggling for a long time, like, these are the heavy hitters that will likely help you get out of there. And so it's not great for business, but I tell people that no one needs ketamine. No one needs an ego dissolution agent. A million other ways to get to a healthier headspace. That being said, it may take people decades, if ever, to get there without some sort of catalyst. Nothing's a panacea, nothing's a cure-all. There's no silver bullet, right? There's a million silver BBs. And so, more avenues we address a problem from, the more likely we are to get capture. And really reiterating to anyone I talk to, and especially the clients that I see here, the importance of the integration. So I've got a whole integration workbook that I created, that really helps people kind of put the pieces together and gives real strong guidance on how to do that work because it is work. You think of, and this is like the whole premise of the treatment. It's like you think of the depression, the anxiety, the suicidality, the substance use disorder, addiction, whatever you want, as those sled tracks, right? Go down a sled track a couple times, gets pretty hardlined. The neurons that fire together wire together is the science behind it. But when you do ketamine treatments, within 2 or 3 minutes of starting a ketamine infusion in particular, you see new dendrites forming on a functional MRI. So it's the ability to quite literally change your mind. And so when we do what we call an induction series, which is a series of 6 infusions over a period of 3 weeks, in combination with some sort of integration therapy, 1 to 2 days after one of those treatments, it's like 5 feet of fresh fallen snow on top of those old sled tracks. And so that all being said, you don't change anything else, there's a real good likelihood you're going back on those old sled tracks. And so I like to kind of reiterate to people like, hey, this is an opportunity for change. And it's really up to you to take it.
Uh, so great segue. I want to understand a little bit better. I honestly don't really know too much about what it feels like, what, kind of the process is. And so if we're obviously we're talking a lot about ketamine therapy, but clearly you all do a lot more there, the integrative approaches. I think you said the I'm going to say it wrong, the psychocranial. Is that right? Or is
Transcranial magnetic stimulation. It's like
transcranial?
modern
Okay.
day frequency healing. You're using a magnetic coil over your prefrontal cortex that
Oh,
causes neuroplasticity all by itself. It's been amazing. Like at first I was like, I don't know about this stuff.
huh.
And now I've seen enough clients that honestly, some of them that didn't respond to the ketamine respond to the TMS incredibly well. So it's been
Oh,
super cool. Yeah, it's just like a tap, 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 like Tim Ferriss, 4 Hour Work Week guy. He used to be like the biggest proponent of ketamine treatments.
yeah.
Now he's less so that and more of a proponent of TMS. And it can be
Hmm.
used for human optimization, and so can some of the ego dissolution agents. It's just important, again, as much as possible in Western medicine, in my opinion, strong medicine should be provided sacredly, in that we're doing
Hmm.
it on purpose, right? So I've turned people away from the clinic who are like, I just want to try ketamine. And I'm like, well, you're not going to try it here. Like, we're trying to help you help yourself. And so if your intention is to try to become a better human, like that's something, we could potentially help with. It gets looked at as this, the silver bullet. Again, I think everyone wants that quick fix, right? And nothing is, to be honest with you. It's like you are the quick fix. It's always in there. It's about remembering how to get there. And I think ketamine does a really good job of getting people to that remembrance faster than most things. Definitely anything faster than anything I've ever given in Western medicine. But as far as like the question you're asking, like how it feels for a lot of people,
Yes, I'm definitely wondering if you can kind of explain, like, what is it? Yeah, what is the experience like? Someone's coming to you because either I'm guessing either they think they need it, another doctor has said, hey, this could really benefit you. I'm sure people show up for different reasons, but to really to experience what it's like to receive ketamine therapy. I know you had mentioned that, you preferred IV, but there's other ways of receiving. I believe it's like nasal spray or maybe. I
yeah,
don't know if
yeah. I
that's
mean,
one of
this is
them or
a
not, but
chemical, so there's a lot of like pretty much any chemical can be
okay.
introduced in lots of different ways.
Yeah.
I like the IV at best again because it's the only version you can pause.
Oh,
There's no reversal agent for ketamine. You just kind of ride it
uh-huh.
out. And
Uh-huh.
so, like, I'll get a warning sign if someone's like, hey, I think I had a decent childhood, but from ages 6 to 8, I just don't remember. I just remember that, like, my uncle lived with me and it was kind of a dark time. It's like warning signs, right?
Mm,
And so it's like, that being said, those heavily repressed memories, like those big, bad, bold capital T's of trauma, they won't come out if they're not safe to come out. And so, yeah, it might suck. I would like warn people. It's so important to do that induction series. And there's some evidence to say extending up to 12 can be helpful for people, but 6 is kind of the standard. And again, I think less
six
is more.
sessions,
Six IV sessions over a period
IV
of three
sessions.
weeks. Again, yeah. And so
Okay.
And we start off kind of low. We're conservative dosing clinic, and then that gives us an opportunity to kind of titrate up accordingly. Most of the time, in that
Oh,
series of six, we get to that point where we kind of overshoot, and then we have to bring it
okay.
back down. There's kind of two thresholds of dosing with ketamine treatments. There's the cyclitic dosing, and that's what people are looking for with the ketamine-associated psychotherapy (CAP), which is a psychedelic-assisted therapy modality. Another reason I like ketamine over all the ego dissolution agents is it's legal. Right. And
Hmm.
so, like, I think there's a lot of people, unfortunately, that are diving in because, I mean, the evidence is really strong. And, the accessibility isn't, unfortunately. That being said, like people die every year from ayahuasca and even psilocybin. And also, ibogaine and ayahuasca are much more dangerous than psilocybin, but there's still a risk of serotonin syndrome with psilocybin. And people don't talk about that because people are still on like sertraline or venlafaxine. They're on a serotonin modulating daily medication from their psychiatrist, and they're like, "Oh, I heard microdosing mushrooms is good, and my buddy grows mushrooms in his backyard, and so I'm going to take a fistful of these, and go out." And then like they put themselves at like a real risk for a lot of different reasons. And so again, I think the ketamine is the safest. It's here now, it's legal, it's given under direction, and it works in large part very similarly. And I would
Hmm.
argue even better for chronic physical stuff because, from a neurochemical standpoint, it's a dirty drug. It's an NMDA antagonist in methyl deaspartate. Also hits serotonin, norepinephrine, and dopamine. Hits the mu opioid pain agonist receptor sites. So it's really good for pain and inflammation. Really good for opioids and coming off opioids. Also, it's the mu or the benzodiazepine receptor sites, and so it's really good for any sort of addiction. It's good for alcoholism. It's good for benzodiazepine withdrawal. Also, it's the mTOR pathway, mammalian target cell rapamycin, and BDNF, brain-derived neurotrophic factor, and that's where the new dendrites come from. So, all that being said, it
Wow.
hits a lot of different channels, and
Yeah.
the
Yeah,
systemic anti-inflammatory effect is huge. You're going to say something?
that's a wide scope
Hmm.
of
Yeah,
effects there. But something
right.
that did stand out to me in what you've been describing, when you were talking about taking it to Mars because it's such a good anesthetic, but it seems to always bring out trauma. That's an interesting factor. Like it's an anesthetic, but it's also a psychoactive of some kind, right? Because I mean, that's kind of a universal thing there you find that and
Well,
that's why it's good for this sort of treatment is it does focus specifically on trauma like that.
and so it's definitely not like ibogaine, and I've never done ibogaine or anything really, but it isn't like you don't have a vivid memory. Like ibogaine, I've heard multiple stories about ibogaine, iboga, and it's like a 22-hour ride through the worst trauma you've ever had in your whole life. Ketamine's not like that. Like you asked me how it feels, and I would tell you it's very different for different people. And so
Hmm.
like some people, yeah, they'll visually replay like the worst trauma that they've had. Most people, it's not like that at all. It's like mo like even some of the people with the gnarliest trauma I've ever heard of, they go through ketamine treatments, and it's just sunshine and rainbows and butterflies and like floating and happiness
Like
and
during
and
the
so
actual sessions.
yeah,
Okay.
and all the latest evidence says that it isn't nearly as important what happens during the treatment, and it's
Hmm.
much more important what you do afterwards. So that's the
Okay.
integration. And so that's why we really like because you'll see people like, oh, I did ketamine and now I'm gonna do ibogaine and then I'm gonna do ayahuasca. And it's like what you really need to do is put the pieces together. You need to see a therapist, you need to do journaling, you need to go outside, you need to like
Hmm.
be physically active. Like again, in our integration workbook. We have like a journaling section. We talk about like very clear guidance as far as like what to do and what not to do, and self-care kind of routines and all these things that are really paramount to get the most out of these treatments. And so it's definitely not a universal thing that that trauma comes out. Very clear guidance with kind of all the ego dissolution agents, I would say, is in large part they'll give you what you need, not necessarily what you want.
Hmm.
And so,
That actually brings me to my other question that I've had sitting here. What's the screening process like? You said, you can't just walk into a ketamine clinic and say, "Hey, can I get some ketamine?" What's the screening process like, and how do you determine if someone is like truly, I guess, eligible for this round of ketamine treatments?
Yeah, absolutely. That's a great question. And so, what we do is we start off with a consultation. And so we used to do those for free, but like time is money, right? And so we charge a $29 placeholder now, which is completely refundable as long as you show up. And so like I don't, again, less is more in my opinion. And so I'm never trying to push anything on anyone. I just want them to have all of the tools so they can make the best decisions for themselves. And so we do a 30-minute consultation with one of our psychiatric providers, myself or my wife. And then some of our other nurse practitioners can do those to be able to kind of talk to us about what they saw and what they heard. And it's a structured interview. We talk about what they've been through before, what their, kind of interests are, what they'd like to get out of these treatments. So we can kind of temper, expectations to some extent. Again, nothing's a panacea, nothing's a cure-all. And the multimodal approach is important to bring up, early and often in any sort of discussion. And then if we do determine that they're a good candidate and, based on the information that we give them, they'd like to proceed, then we move them into the next stage, which is booking out their first, their intake. And the way we kind of term it in our scheduler is intake and possibly first infusion, because we don't do a physical examination, like an in-depth one, until that stage. And then we're checking vital signs, we're listening to heart tones and lung sounds. We're making sure, like physically, this is something that they can tolerate. Again, it's the only anesthetic that actually raises the cardiovascular kind of function, which is good. Because you see a systolic blood pressure normally rise between the top number on your blood pressure between 20 and 30 points. And that's a good thing because that increases what we call the cerebral perfusion pressure, where you get more of the ketamine across the blood-brain barrier and you get more neuroplasticity that way. So it can be a good thing unless people are chronically hypertensive, because we don't want to put people at risk of a stroke, right, or a heart attack. And so if they already have uncontrolled hypertension, that's one reason that we probably wouldn't proceed with treatments. If they have like an aortic aneurysm, then we probably wouldn't proceed with treatments. If they're pregnant, we probably aren't going to proceed with treatments. And it's not that we know that ketamine is a teratogenic, and teratogenic is what they use as a terminology to say that it kills babies. Ketamine is definitely not a teratogenic. It's just that there's not enough information to know that it's safe or unsafe for human consumption while you're growing a body in utero. And so and that all being said, you know, I really like to have that discussion with people, like, what's the potential benefits? What are the potential risks, right? I think people are individuals and they should be addressed as such. And so if there's, someone's like, hey, if you send me out now, I'm not going to the hospital. I'm going to go shoot myself in the parking lot. I'm like, okay, well, it's probably worth doing this treatment. And I've mitigated like multiple inpatient stays where people were going to go to the hospital and they were like suicidal. And then I started their treatments. And again, 95% effective for suicidality. I have no suicidal ideation. I do not want to kill myself anymore. And like, this is something people have been
wild.
dealing with for decades. And they just think that's part of themselves. They've often had multiple attempts, or at least like got pretty far along in the process. And then they do the ketamine treatments, and then it just goes away. It's amazing. It's like
That
so, like,
that's an amazing stat. 95%.
for
Yeah.
suicidality. Yeah. Yeah.
I've never heard anything effective in that level on pretty much anything, really.
No.
Yeah. Yeah. It's
And
bonkers, right? Like I said.
and for something as serious as that,
Uh-huh.
I mean, to
hmm
to actually get people to want to live their life again, that's an amazing effect. That
Yeah.
wow.
Yeah. Yeah. Again, like that's, big picture is like, all right, there's no pill to change your situation, right? Ketamine included. And so like I'm gonna grab one of those books so I can just show you one of the graphics. But the book that I created is the integration workbook right here. And I really there's a lot of it I like because I made it. I'm so proud of myself. But
So your patients will
yeah,
will
patients.
receive this as part of their therapy.
Yeah, exactly. Is that focused? Can you guys see
Yeah,
that?
we can see it.
Yeah.
Okay,
Yep.
cool, perfect. So this kind of like pie graph, like when people first start, again, 95% of the work is likely the ketamine because it needs to feel safe. First, they
Hmm.
need to realize that they are in a pit, right? And then in that pie graph, like the other portions of it are reducing toxicity, wellness living, and making things better. So like reducing toxicity is like removing those people in your life or those stressors that are likely making things worse. The like wellness living is like eating healthy and being physically active and finding community. And then the last part is the making things better. So that's that again, what you had just mentioned, like living life on purpose, right? Living a life worth living. And unfortunately, like too many people get kind of fed this pill for every problem mentality that doesn't zoom out and it's like, well, do you like what you're doing on a day-to-day basis? Are you like, tell me about that. Like, let's go there first.
Yeah.
Curious too, just, I think you said you established the clinic in 2021, but in ketamine therapy, obviously it hasn't exactly been a huge part of like traditional approaches to mental and psychiatric care in the past. But clearly that's changing because we're seeing more and more of clinics like yours, pop up all over the country. What do you think's changing it? Like, what are you seeing in terms of trends? More people are showing up at your doorstep saying, "Hey, I need this," or it's been determined that this is something that can help. I'd just like to hear from your perspective what you see happening and with all the growth, and it's less taboo maybe than it once was. People are understanding more deeply about it.
Yeah, I mean, I think in general, like I'm a cautious optimist by trade, right? And so, like, I'm hopefully and cautiously optimistic. So, with all of that, I like to kind of view what we're doing as, I'm sorry, the door's really loud. Let me close that. So, I think really, like, it boils down to most of Western medicine, the last, like, pretty much 100 years at this point, but definitely last 60 or 70 has very much been a potentiated illness model where the pharmaceutical industry, the insurance industry, and honestly, most providers and agencies are somewhat incentivized to keep people ill, to keep them on daily medications, to keep them coming back forever. And I'm so over that. And I think a lot of people are. So we're working off a wellness model. So after a series of 6 and a 1 month booster, that gives people 80 plus days of really good neuroplasticity, that ability to quite literally change your mind. And that 80-day window is that magic window that people we know need on the upper end of human beings, the science of habit creation and habit breaking. It's between 18 and 80 days for human beings. So you need that a period of neuroplasticity to create new habits and to break old habits. And so again, we really like to emphasize the need for a bigger picture zoom out. As a clinician, like I've recognized over my time working in healthcare, like it'll lead to a lot of burnout. And this is how I teach my staff too, if we're trying to carry people over the finish line, right? And so really working on that empowerment, like helping people remember that they're in charge of themselves and it's up to them to make those shifts. So like two Buddhist sayings that I like is one of the biggest forms of human suffering is looking at an old photo of yourself and thinking you're the same person, right? You have a capacity to completely change your and how you fit into this reality in this universe walking out of the store from walking into the store. And that exists in all of us each and every moment of every day. And good and bad, right? And then the second one is like holding on to resentments is like swallowing poison and expecting someone else to die. And so it's like
Ah,
it's so important to let go.
yeah.
And again, the big picture is like this happened, making that shift from this happened to me to this happened for me,
For
right?
me. Oh my gosh, I'm so glad you said that. I have a friend of mine who is a just speaker, but she runs like kind of like, I don't know, not really like self-help, but she might kind of fall into that. And she has taught me to say that. This didn't
Right.
happen to you. This has happened for you. Now think
Yeah.
about that. And it's just changing the way, changing your mindset, right? It's It's changing the way you think about things.
It's the difference between a blessing and a curse. And it's, you decide which one you want it to be and you make it that, right?
Yeah.
Yeah,
Um,
yeah, 100%.
I want to ask you a question too, about a word that you've said a couple of times. And I heard the same word in our interview with Jessica Tracy from Anthea, um, neuroplasticity. Hopefully I didn't
Hmm.
Yeah, you said it
jack that word
perfectly. Yeah.
up. Can you talk about what that is? I've heard this word now multiple times. I'm honestly not entirely clear what it is. So could you
Yeah.
kind of explain that a little bit?
Absolutely. So basically, long and the short of it, we're trying to get people back to that childlike state of curiosity, right? And so like instead like we don't learn anything with our mouths open, right? And so here I'm like just blathering my face off. You're like, oh, this guy must be dumb. That was an opportunity to talk. I'll take it, capitalize it. Uh, in general, so we talked about the multiple pathways that ketamine travels on, NMDA, all the, and then that BDNF, brain-derived neurotropic factor, right? That's where we see the new dendrites forming on a functional MRI. We used to think in medicine, age 25, your brain just starts dying. You can never, like, you can't teach an old dog new tricks. We know that's not true. You can learn things up until your deathbed. And ketamine and the other ego dissolution agents work incredibly well at putting that brain back in that plastic state. And so they've done some MRI imaging studies and that sort of thing. And basically, your brain goes back to that super learnable state. And so like there's been a lot of kind of work in a lot of different fronts. In Silicon Valley, there's like it's big enough to talk about microdosing Fridays, where like their intention is to be able to solve a big problem that they've been working on, and they take a tiny dose of an ego dissolution agent, and then they're able to oftentimes work through whatever their blockage was, work through whatever their problem was. And so we see those same types of abilities with obviously the ketamine infusions. But there's lots of ways to get there. Like you can create neuroplasticity with stimulating conversation. You can create neuroplasticity with a big hug with someone you really care about. You can create neuroplasticity like being outside and literally hugging a tree. You can create neuroplasticity with like painting artwork or singing a song or playing a musical instrument. There's lots of ways to get there. And again, all the ego dissolution agents are considered non-specific amplifiers of the human experience.
Okay. I like hugging trees personally.
Perfect. My
I
friend just
do
told me
that
about this. Like,
literally. Awesome.
Hugging trees.
you guys heard the strawberry vanilla chocolate thing for the ponderosa pines?
Oh, yes. It's like if it's a female versus a male tree or something, it's a different flavor that you smell.
I don't know the science of it, but like, I grew up here, right? And I just heard about
Right.
this. So like you go like a great opportunity to hug a tree.
Uh-huh.
Like different trees have a different like very
Scent.
distinct olfactory,
Right.
scent coming off of them. And some are
Yeah.
very distinctly vanilla and some of them are very distinctly berry. It's really cool. I was like
I've heard
going
that.
around smelling trees the other day.
Let's go around
I
and
was like,
hug
how
some
did I
trees.
just find this out?
I hear that from people. They say, "Oh my God, I could smell the vanilla when I get up here." I'm like, I don't know. Maybe it's because I live here all the time. It's just like normal that I don't notice the the scent.
Yeah, for
So
sure. You're conditioned, right? Yeah, for
yeah,
sure.
I was like, this is just normal. This is what it always smells like. But
Yeah.
yeah, I'm all for tree hugging.
Yeah.
We should do more of that. All right,
Yeah.
thank you for explaining that. I was kind of curious about what that word, but I'm gonna have to go do a little research on that now. And actually, interestingly, you were talking about the microdosing Fridays. I literally just saw an article from the New York Times this morning about CEOs, like executives, doing these like psychedelic retreats. There's apparently some place, I don't know exactly where it is, maybe somewhere in California, who knows, but where they're doing these retreats to like achieve like this higher level of, I don't know, spirituality and understanding to be a better executive. So I'm gonna have to read the whole article. I'll send it to you too if you haven't seen it. But I started reading it and I thought, well, that's interesting. But I hadn't heard about the microdosing in Fridays in Silicon Valley, but that doesn't surprise me either.
Yeah, yeah, we're doing because our licensure covers like remote, and so we just started Revitalize retreats, which
Oh,
we can give on-site ketamine, obviously there's more of a hands-on approach to that. And we do the same kind of heavy vetting to make sure someone's a good candidate and safe
Uh-huh.
to do it, before we proceed. But yeah, there's a lot of movement in that realm, and I think it's
Yeah.
important to, again, as much as we can, really make sure we're delivering something so strong on purpose, and
Hmm.
we're really trying to hold that kind of ethos. I think if you don't, this is so just because I think you might be able to have like a wide field of distribution, and I'm kind of like stuck in my own, like,
Hmm.
I think everyone knows everything, because that's who I hang out with.
Of course,
But
you
if
are
you
who you
don't,
hang out with, right?
right, yeah, and if you don't learn from history, you're doomed to repeat it, right? That's kind of my school of thought. And so the 1960s, 1970s, huge body of evidence coming out about
Hmm.
how effective like all of these treatments were, for, really that the like curative for depression, curative for anxiety, curative for PTSD, curative for alcoholism. Like Bill W., the founder of AA, he took ego dissolution agents to the board multiple times to try to get them to incorporate ego dissolution agents into the curriculum of Alcoholics Anonymous. Really interesting stuff. But what happened, in my opinion, back in the 1960s, 1970s, there was this huge body of evidence of efficacy. And then what happened was a lot of the prescribers, a lot of the practitioners, a lot of the researchers started dipping into their own supply, getting high on their own supply, and then lost their credence as non-biased researchers, non-biased clinicians, started joking about putting a water supply, started joking about slipping it to politicians. So I think it's really important to hold a high ethical standard when it comes to these treatments, in that they're not for everybody, and no one needs them, right? And it's my opinion. And so, yeah, they can be incredibly helpful. But what happened, in my opinion, again, looking historically, is that when the inevitable other foot dropped of like kind of consumerism, capitalism, kind of, we consume, and they're like, hey, people are consuming less. There's less of a kind of reciprocity going on here. Then those researchers, those clinicians, they didn't have any feet to stand on when it came to like, hey, like, and then they got all lumped together. Like all the ego dissolution agents got lumped together in the war on drugs. Like they are so far away from benzodiazepines. They are so far away from opioids. There's no physiological dependency. Um, Oxford, I think out of the UK, they did like a study where they put every substance that you could potentially use and might shift your perspective in some ways, like head to head. The most far and away dangerous one out of every substance that human beings could use is alcohol. Like it's killing the most people per capita of people using it. Least dangerous is psilocybin, magic mushrooms, like far and away. Like we're talking like orders and orders of magnitude. So and again, like people could use ketamine or psilocybin like every day for years. I don't recommend that at all. But then you could stop it abruptly, and there's no danger, no physiological dependency. Can people become addicted to the way it makes you feel? Absolutely. Like just like you can get addicted to like going to the gym, or like addicted to certain people in your life. You can get addicted to the way ketamine makes you feel. Some people hate it. Some people really dislike the feeling, and they still come back because of how effective it is at helping them. Like the biggest thing I hear people say is like, everything's the same, but everything's way more tolerable. Like people aren't pushing my buttons as much as they used to be, and they're doing the same stuff. So everything just gets much more tolerable as you're kind of working through these things.
Yeah. Well, it's fascinating. I've learned more about ketamine in the last like 3 weeks than ever before. So
Right. There's
yeah,
a lot.
it is a lot, and I'm happy that it's gaining traction. It's becoming more, it seems to be more, I wouldn't say traditional, right? It's not quite there yet. Is that a fair statement? But we're getting
Oh
there.
yeah, absolutely not. And there's always going to be, and that's why I say, really want to be ethical with our
Hmm.
delivery. And like I'll treat people from like LDS, I'll treat people that have done hundreds of ayahuasca ceremonies. Like,
Mm.
our clinic is really a clinic, so we have
Hmm.
a medical side, and we have that kind of. It's important. Like we go through intention setting in there. We go through our flight instructions,
Hmm.
and so we're real with people. But it's a medical clinic. We do electrocardiogram, we do blood pressure, we do pulse oximetry. We make sure people are safe. We do what we call the intrinsic response methodology. Whole premise of that is you'll always be your own best healer. Like you cut your hand and I put a band-aid on it. Am I healing it? course not, right? You're still healing it. And so same thing with brains, they don't live in an anxious distress states either. And so we know the more we reduce the external stimulus, the deeper you're able to go and the more healing work for yourself you're able to do. And again, like that combination of, like bringing my own trauma. So especially when there's a power dynamic in people, like clinician and client, right? Like I saw this all the time when people come into my psychiatric office, like that pedestalizing of other people's expectations of us. So you come in, hey, how's it going? And you're like, I'm great. I'm like, no, you're not. Right? You're here on purpose. And so
Mm-hmm.
like we're all trying to kind of, we wear these masks and we have to some extent. Like I said,
Mm-hmm.
you can't live in that ego dissolution state, nor should you. Like I think a big part of the winning the lottery, right? As the three of us did, how many swimmers did we compete against to be where we're at, right? And so like the lottery is, in my opinion, feeling that gambit of emotion. Like that's what we won. And so getting that heartbreak and being able to come back from it, right? Getting that elation and that joy. And so being able to have that human experience and be able to ride the highs and sit with the lows, and not be stuck in any one of them. And when someone's stuck in any one of them, that's a great opportunity to call us. And that's a great opportunity to, when you feel stuck, that's what these are really good for.
Yeah. Well, I think that's a really great message to end on. And I don't know if I speak for Jeremy here. I think I speak for Jeremy here. I think we're pretty excited to see this as a growing trend and becoming more and more a part of kind of the, repertoire of mental health and psychiatric support. I've certainly never heard a bad story from anyone who has gone through ketamine therapy or in the integrative, I think some of the integrative methods that you've been talking about. So,
I was just going to say it's rare to hear about new treatments and things like that in the healthcare world where it's all good news.
yeah.
I've never heard anything bad about it either. Everybody who has anything to say about it, it's all good. So
Mhm.
yeah, I'm excited this became one of our initial focuses on the uprising here. Yeah.
Yeah. Yeah. And ketamine therapy is definitely just in line with a healthcare uprising, right? So
Yeah,
let's
absolutely. Yeah, no,
let's
I
bring
really
it to the
appreciate you
masses.
guys having me on today, and
Yeah.
I'm excited. Maybe someday we'll get to meet in real life. That'd be cool.
I
Yeah, that'd be
know.
cool. We are all in
Yeah,
Flagstaff.
yeah,
IRL.
yeah.
Where can we find you online? Just share really quickly where your locations are again. I know you mentioned it in the beginning of the show, but let's tell people where to find you.
Sure. So like Instagram handle is RevKeta, REVKETA. And you can get to our website at that www.revketa.com, or revitalizeketamine.com. And we have physical locations in Flagstaff, right off of University, and Sedona in West Sedona, across from the Bashes, an old Bank of America. That's where I opened my first bank account, by the way. It's fun.
Oh.
And then the third location in Prescott Valley off of Windsong Drive. And then we have our two wellness bar locations, ROHCT Wellness Bar. So revitalize, optimize, and harmonize clinic and therapeutics. Really a place for you to become the best version of yourself and a place to continue the work, right? We're all a combination of 5 people you spend the most time with. So trying to be around people who are also trying to be slightly better versions of themselves. It's a continuum of sunlight and infrared sauna and cold plunge and a lot of biohacking and human optimization, kind of
Ah.
modalities out of that space. And again, widening the funnel. So there's so many other things we're doing out of those spaces. And we have that one right across from Target, the Green Tree Shopping Plaza, right by the old Warenberg, if you really want to date me. And right next to Campus Coffee Bean.
Yep.
And then across from Target. And so that's our first ROHCT location.
Okay.
And that's a 24/7, like badge in, badge out.
Oh,
We have red
wow.
light
Okay.
therapy. We have the chili goat cold plunge, Michael Phelps chili goat cold plunge,
Hmm.
co-working, lots of cool stuff out of there. And
Wow.
so we have different membership tiers available. And then the ROHCT Wellness Bar is attached to the Revitalize Ketamine Clinic in Prescott Valley. And then rocked, so like getting rocked in a good way, or you start at rocked bottom, the
I like
the the
it.
foundation of wellness.
Uh-huh.
So
Let's rock, man.
yeah,
Wow.
Let's
yeah, get
rock.
rocked in a good way, right?
Let's get rocked.
Yeah, I have too much metal for
Yeah.
one hand.
There we go. I'm down with
So
that. I love
Yeah.
it. Well,
We do like Flow Fridays. We'll be at the light parade on Saturday.
oh, cool.
And so lots of cool ways to find us. So
Yeah.
ROHCT Wellness Bar, www.rohct.com. And so
I've
between
seen this. I've seen the sign for that over by Target
nice.
there. I was wondering what that was.
Now
No
you
idea.
know.
Yeah, it's
I
a
learn
wellness
something
bar.
new every time we do an interview.
We have the hug flower there, like Bessel van de Kolk's work, the body keeps the score. So we hold so much of our inflammation, our trauma in our body and our lymph system. And so it's like this lymphatic massage that helps you clear that stuff out that
Oh,
you're holding on to, put in your vascular system so you can clear it out with your liver and kidneys. And it's like the best hug you'll
wow.
ever get. Like people love
That
it.
is so
And
cool.
yeah.
Man, the body is truly a
No,
miraculous thing. It's just
Mhm.
anyway.
we might have to do
Yeah.
a whole nother road about the whole biohacking thing.
Yeah, biohacking
Yeah.
is something that I am extremely interested in learning. We didn't get to touch on it much today. We're out of time, but
We'll bring you back on for that later.
we might just have to bring you back, Casey, and we can talk about biohacking and that whole phenomenon, which is
Yeah.
another completely different path. We can go a billion ways with this one.
Yeah.
This
There's a lot of
conversation is going to
synchronicity. Yeah.
continue
I love it.
for
Well, I
sure.
appreciate you guys having me on and
Yeah,
thanks
Yeah.
for doing
Thanks
what
for
you're
coming.
doing. Yeah,
great.
absolutely.
Awesome. Thanks,
It'll be
Casey. It
great.
was great to
Thank
have
you.
you on today.
Yeah, appreciate you both. Have a
Okay.
wonderful day.
All right. Well, there you go, health heads. Our conversation with Dr. Casey from Flagstaff's Revitalize Ketamine Clinic. Definitely some deeper thoughts, some amazing statistics. Really a lot to think about in there. I think that's going to be kind of like on the deeper end of the conversations we'll have on the uprising here. And I'm looking forward to the ketamine therapy roundtable we're planning for the future. I'm sure I can formulate some deeper questions for the good doctor by the time that comes around. But what would you say our main takeaways from that conversation are, Heather?
Well, I think in general, ketamine therapy is becoming more widely understood and accessible in our own communities. I think, ketamine clinics will be showing up on nearly every main street, right? Or
They almost are already.
they almost are already. So if you want to know more about it, you can probably find someone in your town who's already running a clinic like a Dr. Casey. So, and it's a really great form of support for a number of mental health care needs. So if you feel like you need something new, something different, an alternative way of approaching mental health, it's worth exploring. You could maybe find a happier, healthier life on the other side. So
There you go.
don't leave anything off the table.
Yeah, open mind, right? Open mind to new therapies can be very important.
Hmm.
A closed mind might keep you from feeling better. What's the point of that?
Exactly.
But on that note, if you enjoyed what you saw and or heard today, you can join up officially with the Healthcare Uprising at patreon.com/healthcare uprising. We record ahead so you can get early access to upcoming interviews, including the rest of our ketamine series. If you're interested in finding out more, I think we have like 5 or so episodes total on this in the end. So we got a few more coming up still. But yeah, patreon.com/healthcare uprising. You can join for as little as $1 a month. It goes up from there. You can get yourself some free merch if you join at the higher levels and stuff like that. That's where you get in on all our kind of private community chats and things like that. We will have some member only spaces for our deeper conversations on things like this. If you just want to be a casual listener, we are on all the major listening platforms. You can also watch us on YouTube. Just search Healthcare Uprising.
And you can also find us online at healthcareuprising.com, as well as on all the social media platforms like LinkedIn, Instagram, Facebook, and Blue Sky. Just search Healthcare Uprising Podcast and you'll find us. But if you have a story to tell, a new product or business we can learn about, or even just a question for us or one of our interviewees, shoot us an email at healthcareuprising@gmail.com. So that's it for this dose of Healthcare Uprising. Until next time, keep looking for the good in the world. Sometimes it's where you least expect it.
This has been a Shut Up production.
Shut up!